Hello, I'm Alison Page. I'm the chair of the Anti-Cancer Partnership. I'm really pleased that you've joined us tonight. Hopefully more people will join along the way. We've had about 25 people booked on, plus us who work on the anti-cancer programme and our speakers. So hopefully people will be still popping in as we start. So just a reminder, please keep yourself, I know if you've been here a while, you're sick of hearing me saying this already, keep yourself on mute when you're not speaking. If you can show yourself on camera, that would be great. But even if you need to leave it off, if you could turn it on, unless there's an issue with that when you're speaking, because I'll lip read. The session's being recorded, so if that's an issue for you, then obviously turn off and change your name, or send a message to the host in the chat. People can leave comments or questions in the chat at any point. The chat's open all the session, and we are asking people to introduce themselves, just to say who you are, and if you're from an organisation, where you're from. Martin's now put the agenda in the chat for those who haven't seen it before. So welcome. So this event is from the Anti-Cancer Partnership for Greater Manchester. It's called Let's Talk About Cervical Screening, and it's about and aimed for lesbian and bi women in Greater Manchester. I'll just tell you a little bit about me. So I'm your chair for this evening, and the rest of the time I am the chair of the Anti-Cancer Partnership. In my day job, I'm the chief exec of Salford CVS and the director of 10GM. So we are local infrastructure organisations in GM. Salford CVS and 10GM are partners in the Anti-Cancer Partnership, and we're joined in that partnership by BHA for Equality, Unique Improvements and Voluntary Sector Northwest, but also we work with the BME Cancer Partnership and do with a variety of their members on spot purchasing projects, and also with a wide range of VCSE groups and organisations from across Greater Manchester. And we've got participation from all of the 10 local authority areas. Of relevance this evening, I suppose, is that we all wear many hats and we're not cardboard cutouts. So I'm a 58-year-old lesbian. I've never been in. I've been with my partner for over 30 years. I've been involved in lesbian and gay politics my whole life, from being a teenager, and particularly around, I suppose, the women's movement and feminism, vegetarianism, socialism, you name it. I've got a big mouth. I'm a Mancunian, and I've probably been out there on the protest or picket line. I'm really interested in health and the misinformation. Certainly when I was growing up as a lesbian, we used to be told you don't need to bother with cervical smear tests, lots to unpick there. So I suppose what I'm really keen on doing now is just telling you some housekeeping, just a reminder about names, on mute, introduce yourselves in the chat, and then we are recording this. And I'm saying this again, not because I want to waste your time, but because people are joining us all the time. So if we can also put in the chat, Martin, can you just type in that we are recording this session? That would be really good. So I'm ably assisted tonight by Martin and Vanessa and Johnny from the Anti-Cancer Partnership, and this is a team effort. So about anti-cancer, well, what is anti-cancer? So it's a VCSE-led partnership. It's commissioned by the Greater Manchester Health and Social Care Partnership. We're in year 3 of a 4-year contract. Interestingly, when I was doing an analysis last year, I thought, blimey, why has this felt hard? And I thought, well, actually, for a community engagement programme to have 5 of its 8 quarters in COVID, in a pandemic, the like we've never seen, it, felt like an uphill struggle at the time. We've got a fantastic team of not just paid staff, but also cancer champions, individual cancer champions and organisational cancer champions, supporter organisations, and our partners in the partnership and also in localities. And I think we've achieved quite a lot given those challenges. So what's important to know is the idea of this. It's about community engagement via the VCSE sector. It's about creating a social movement so that cancer awareness and awareness of the cancer screening programs is everyone's business. It's very much targeted at those people who have been deemed as hard to reach or hard to engage. And specifically of that has been looking at geographical areas where screening uptake has been difficult. So we are working predominantly in 5 of the 10 local authority areas. We work across all, but our more detailed on the ground work is in Manchester, as in Salford, is in Bolton, is in Oldham, and is Haywood, Middleton and Rochdale. But we have supported activities in all 10 local authority areas. That's really important to note. And our focus really has been around engaging with Black, Asian and minoritised communities. It's around carers and people with caring responsibilities, people who struggle with mental health. Homelessness and secure housing has been one of those areas we've looked at, because of looking at people who live in what's known as areas of deprivation or lower socio-economic groups, whatever you want to say. And also, and most pertinent tonight, in terms of looking at people from LGBTQIA plus communities and not seeing people as a blob. And that's true also of disabled people, and it's true of Black, Asian and minoritized communities. What we've worked really hard to do and continue to do is try and say that we recognise that although sometimes people have more in common, we're all distinct individuals. And also there's the whole question of intersectionalities, isn't there? So we've all done the jokes about, you know, lesbians, working class, disabled, one leg, so on and so forth. And we've all jokes about everyone, but we are absolutely rounded individuals, and that's the point of this. And tonight, what we're really, really keen to do is explore the issues around cervical screening and lesbians and bisexual women. And the reason we're doing that tonight is because it's LGBT History Month, and we wanted to have a good discussion around the smear test, as I call it, and why it's important for lesbian and bi women to participate in those screening opportunities. We know that there's been a massive amount of myth and disinformation for many, many years. And we know that that surrounds, you know, anyway, women undertaking smear tests, and who's in charge of that, who gets to decide whether lube's used, who gets to decide on the size of the speculum, who gets to decide when you go for the appointment and who's in the room. So many things to discuss. So we're really keen and we're really pleased tonight that we've got some colleagues here to talk to us around some of those key issues. So I'm pleased to welcome Sarah Jones, who's the Screening and Immunisation Coordinator at the Greater Manchester Health and Social Care Partnership, who's now going to talk to us about this issue from her perspective. So Sarah's going to be telling us all the facts, and I like facts rather than myths, around cervical screening, who is eligible, what it involves, and why it's so important for us to take part. Sarah, over to you.
Thank you very much, Alison. I'm just going to share some slides, mainly just to keep me on track. They're not the most advanced. Right. Can you see that?
Yes, thank you.
Brilliant. Okay, so my name's Sarah Jones. I'm Screening Immunisation Coordinator at the partnership, and my role is kind of overseeing the whole of the cervical screening pathway. So from the invitations being sent all the way through to if someone has a positive screen and needs to be referred on for treatment in colposcopy. So I'm going to give you an overview of the National Cervical Screening Programme, a bit of information about cervical cancer, the HPV virus, and what happens when you go for a smear test. Okay, so cervical screening, it's a free health test available on the NHS, and it's a national programme, so it's standard across England. Wales and Scotland do have the similar programmes, but they do vary slightly. So I'm just going to be talking about the programme in England today. So it helps prevent cervical cancer by checking for a virus called HPV, and then also looking for any cell changes on the cervix, which could be precancerous cells. So screening is for anyone with a cervix, any healthy women with a cervix. And by healthy, what we mean is without symptoms. So if someone has symptoms of cervical cancer, then screening isn't the best route for them. The point of screening is to get healthy people and to see if they have any indication of potentially having any cells changes that could mean they have cervical cancer. So it's not for anyone who has symptoms. If you do have symptoms, which I'll talk about later, then we'd encourage you to speak to your GP. The programme starts to invite people from the age of 24 and a half, and you continue to receive invitations up to around the age of 64. So between the ages of 25 and 49, you get invited every 3 years. And then once you turn 50, you get invited every 5 years. And some people might be offered screening more frequently. So for example, if HPV is found on your screen, then we will screen you annually. And people who are living with HIV will also be offered annual screening. At the moment, only people who are registered as female on their GP record will automatically be invited for cervical screening. That's because the computer system that they use nationally is very, very old and can't do it any other way. Anyone who has a cervix, such as men or non-binary people, you can request screening from your GP if you're not registered as female, but you won't automatically get invited. Hopefully that will change in the future. If you are registered as female but don't have a cervix for whatever reason, then you can request that the invitations are stopped and you won't receive them. That could be because you've had a hysterectomy or because you don't have a cervix for any other reasons. As Alison alluded to, in the past, a lot of lesbian women have been told that they don't need cervical screening because they don't have sex with men. This has been a myth that kind of, I hope that we've kind of getting to the end of now, and that healthcare workers, people taking the samples are well educated and they know to offer that to anybody. But I think probably there is still some misconception out there. So hopefully we can face some of that today. Anyone who's within the recommended screening age should and has a cervix should consider having cervical screening, regardless of who you have sex with. And research on screening in lesbian and bisexual women does suggest that lesbian women are less likely to go for regular screening at the recommended intervals. It's totally up to you if you go for cervical screening or not, but you should be given all the information that you need to make an informed decision yourself and not be told by someone else that you should or shouldn't have it. So cervical cancer is cancer that starts in the cervix. It's mainly caused by the HPV virus. The vast majority of cervical cancers is caused by the HPV virus, and that can cause changes in the cells of the cervix, which could then later develop into cancer. And on average, this process takes a very long time. It could take between 5 and 20 years for that from that initial HPV infection for it to develop into something like cervical cancer. Most cases are in people under the age of 45, but it's possible to have it older or younger than that. And it's most common in people with a cervix in their early 30s. Around 9 people are diagnosed every day, and the risk is higher in people who haven't had HPV vaccine or that don't attend for their screening. So I mentioned earlier about symptoms. So symptoms of cervical cancer can be abnormal bleeding, which is bleeding during sex or between periods that's unusual for you, unusual discharge, pain or discomfort during sex, and unexplained lower back pain. But remember, those symptoms can be so many different things and doesn't mean that you have cervical cancer. But if you do have any of those symptoms, we recommend that you speak to your GP, who'll be able to refer you to someone to have a look a bit more detail. So HPV is a virus. There are around 100 different types of HPV virus, and most are harmless. Some cause things like genital warts, and then there's some strains that we called high-risk HPV strains, and these cause the majority of cervical cancers. They can also cause other cancers, such as head and neck cancers, anal, penile, vaginal, and vulval cancers. They're less common, but it is possible for the virus to cause those. We don't currently have screening programs for any of those types of cancers. So anyone who has had any kind of sexual contact is at risk of getting the HPV virus. It mainly lives in the genital area, although it's possible to spread it by touching or using sex toys. This is less common. It doesn't matter what kind of sex you have or who you're having it with, there's always that risk. About 8 in 10 people will get HPV, so it's very, very, very common. Most people get it, and that's why it's because it's so easy to spread. So using barriers can help reduce the spread, and also, if you're eligible, taking up the offer of the HPV vaccine. So research suggests that although HPV it can be more easily passed on through intercourse that's more kind of traditionally heterosexual, so penetrative. It can also be transmitted through any other kind of sex, oral sex, anal sex, and it's passed on through kind of bodily fluids and touching. So that transferring any vaginal fluids or sharing sex toys can all be ways of passing on HPV and being exposed to it. If you are under 25 and you missed the HPV vaccine at school, then you can ask your GP practice if they can offer that to you. So up to the age of 25, you're eligible to kind of catch up on it if you missed it. So going for a cervical screen, I'm just going to give you a bit of an overview of what happens. So you should get a letter when you're due your screening if you're registered as female and you haven't removed yourself from the programme. If you think you might be eligible but you haven't got a letter, then you can speak to your GP and they can arrange a screen for you. Normally you'd book in with the GP practice. Some sexual health clinics also offer screening. That's not as common, but we are working with sexual health services to try and increase that offer at the moment. You should try and ensure that you're not going to be on your period when you go for a screen, because it can affect the test, so it's not the ideal time to go. And try not to use any kind of lubes or spermicides or any kind of vaginal creams or medications around 2 days before you screen, because again, anything that's on the cervix can kind of affect the screen. It gets picked up with the cells. The nurse or doctor will check your details and explain the process to you. You can wear whatever you want, but it might be easier to wear a skirt or a dress if that's something you feel comfortable with. You should be given something to cover yourself up. Normally it's like a piece of blue roll or a paper towel. And then there's lots of different ways that you can lie. So the person taking the sample will give you some tips on what to do. So it might be on your back with your legs bent or your ankles together and your knees apart, or some people prefer to have it done on the side with the knees bent. If you have it somewhere like in a hospital or a sexual health clinic, they might have stirrups that you can put your legs on that make it a bit easier for the sample taker to take the sample. So the next page, we've got a few pictures. So here we've got what we call a speculum. So there's lots of talk about speculums. They do come in lots of different sizes and lengths, not just kind of width. So you get small, medium, large, and then you get longer or shorter ones. And you can ask for the nurse to use a different sized speculum if you think you might need a smaller one. So the speculum here on this picture is used to kind of open the walls of the vagina and make it easier to see the cervix. So although you can absolutely request a smaller one, it might be that the nurse can't see what they need to see with that speculum. So it's not uncommon for nurses to try a few different sizes to see which ones work best. But you can absolutely request a smaller one if you think you might need that. Then they use this. This looks scarier than it is. It's like a little brush. It's quite soft, and they just take some samples from the neck of your cervix. They twist that brush around a few times, and then put that into a pot with some liquid. And kind of mash it around a bit. Mashing is the technical word. So they mash it into the pot, and then that gets sent off to the lab for testing. So just a few tips. If you think you're going to struggle with the procedure, then please tell the nurse. If it's your first time and you feel embarrassed or worried, you might want to ask for a pre-appointment so you can talk through it first and talk about any worries that you have. A lot of GP practices these days will have online consultations. So if you feel too embarrassed to speak to a nurse, you could maybe put it in an email or put it on an online consultation. Just let them know that you're a bit nervous or concerned. You can ask for a double appointment or try and take someone with you, which during COVID's not been the easiest, but you can always request and see what the policy is. And some of the other things that I've talked about asking for a smaller speculum. And if you're going through the menopause, you can let the nurse know. There are various creams and medications that you can use if you think that you'll struggle due to issues around menopause, like more vaginal dryness and things like that. So then what happens? The sample gets sent to the lab, who do an initial screen for the HPV virus. If that's negative, then that's it. You'll get a letter, and you'll be invited again in 3 or 5 years' time, depending on your age. If it comes back positive for the HPV virus, they will have a look at the cells under a microscope and look for any cell changes, and that's called cytology. And if any cell changes are seen, then you get referred to colposcopy at the hospital, who are a specialist team who can have a closer look at your cervix and carry out any treatment that you might need. If your test comes back HPV positive, but with no cell changes, so the virus is there, but there's nothing that looks abnormal, then you'll be invited back to have another screen in 12 months' time, and they'll just keep monitoring that infection to see if anything develops over the next couple of years. So there's always risks and benefits to any medical procedure or screening programme, on the national leaflet that you get with your screening, it does kind of explain some of these risks and benefits. So the benefits of cervical screening is that screening can identify changes that might show that you're at a higher risk of getting cervical cancer, like having the HPV virus. It means that you can get the treatment and care you need earlier. And the new HPV screening, where we look for the virus, means that people with a higher risk can be screened more frequently and be called back every 12 months. However, on the other hand, screening isn't 100% accurate. There's always a small chance of an incorrect result. And sometimes cell changes and HPV viruses, they just clear themselves. They go back to normal without needing any treatment. But we don't know whose cells are going to go back to normal and whose don't. So sometimes people might have treatment that they wouldn't have needed, but there's no way for us really to know who that is. So overall, the cervical screening programme is highly recommended for the majority of people. The risks will outweigh the benefits will outweigh the risks. That's a mouthful. And for the majority of people, the results will be clear. And for those who aren't, you'll get that treatment much sooner than potentially you would have done without screening. There might be additional barriers to you personally taking up the offer of screening, and Ellie's going to talk about some of the barriers to cervical screening now. But I really encourage you to speak to your GP or practice nurse. And also there's Joe's Trust, which is a charity that I've just put some contacts here. They've got a helpline, cervical cancer charity, and they can talk to you about any issues or questions that you've got at any time. So I highly recommend them. So that's it from me.
Thanks, Sarah. I thought that was really enlightening. I was just going to ask Martin, are we going to make the slides available after this to everyone? Because they've got the live links.
If Sarah's happy with that, then yes, we can do.
Is that all right, Sarah? Yeah. I don't know if you can put them in the chat now or if we have to send them out afterwards, but I think it'd be really useful, particularly in terms of that list of links. So I'm sure you've got questions, but hold that thought, because we're going to have a Q&A session after our next speaker. So as Sarah's already mentioned, we've got Ellie's going to talk to us now about what the barriers are to screening that some lesbian and bi women face and how we can help remove them. So I'd like to introduce Ellie White, who's the Women's Programme Coordinator at the LGBT Foundation. So over to you, Ellie.
Thanks very much, and thank you so much. That was really interesting, Sarah. I really appreciate it. So here we go. My lovely shiny PowerPoint. As Alison said, my name is Ellie White. My pronouns are she, her. I am the Women's Programme Coordinator at LGBT Foundation. You'd think with the amount of times I have to say that, I wouldn't stumble on it. Not correct. So I'm going to be talking to you today about lesbian, gay and bi women's experiences and cervical screenings and what some of the barriers are there, and maybe some of the stuff that we could do about that. I will say I'm very grateful that Sarah's been here and done the more healthcare side of this. That is not something that I am an expert on. I am a person who has had a cervical screening and a person who in my role advocates for LGBT women. So I have that knowledge, but I'm very glad Sarah's here to answer the more technical questions, and I really enjoy that mashing is the technical term when taking a sample. That's great. So yeah, I'm going to talk to you about some of the potential barriers. Again, Alison touched on this, but this is an incredibly nuanced conversation, and these are just broad strokes, some of the barriers for LGBT women. And I can't cover all, and I can't cover all the intersections that come with that, but hopefully this is enough to sort of get us thinking about those barriers. So to start, this is a statistic we have from 2018 that 17.8% of LGBT women of eligible screening age have never been for cervical screening. It's just too high. That is a very high number, and as Sarah's mentioned, you know, cervical screenings can do a lot to prevent really drastic and serious conditions, and so this is a challenge that we all need to face. So what are some of the barriers LGBT plus women with cervixes Again, you'd think the amount of times I say that. What are the barriers to LGBT plus women with cervixes accessing cervical screenings? There we go. So first off, the myth that they don't need one. This is something that's been touched on by both Alison and Sarah, but I'm going to talk about it some more. So we did some research in 2013 and produced a document about LGBT women accessing cervical screenings. And in our research there, we found that 44.5% of LGBT women of an eligible age have been told they don't need a screening because of their sexual orientation. Now, obviously, I'm aware that this number is, you know, it's 10 years old at this point, but a large group of that number will still be going for cervical screenings and will still be holding on to that information. So this is a myth that has really taken hold. There was previous NHS advice that if you weren't sleeping with men, you didn't need to go for one. As we know, that's not the case, and that is not the line anymore, which is fantastic. But it is really difficult to counter that misinformation when something like that takes hold, because not only have we had to remove that idea from healthcare professionals, we also have to remove that idea from community members. And if everyone's going around saying, oh, well, I don't think you need one, then it just perpetuates, it just gets bigger and bigger, especially when we consider the fact that people don't really enjoy cervical screenings. They're not the most pleasant experience. And so anything that feeds into this idea that you might not need to get one is going to appeal, and that gives it more weight. But again, going back to the healthcare professionals, so we have a quote here from that research in 2013. I put off going because at least 3 nurses over the years have said if you don't have sex with men, you don't need a test. As I was really scared of going, this just made me decide not to bother. And again, I'll say that I'm very aware that, you know, this isn't the line anymore, and this isn't what people are being taught. But once that takes hold, that is the difficulty we have encountering. So that is one of the barriers, and quite a large one, I'd say. So the second one I would say would be lack of understanding around HPV and STIs in general. I have had the HPV vaccine. I have been for my first cervical screening. I have prepared this presentation for you today, and that summary from Sarah is the most information I've ever been given about HIV in the most clear way, and I feel very well informed now, and I would love to have been more well informed before. Maybe that's on me, but I think there is a lack of education around around STIs in general and HPV more specifically. So this stat I've got for you here comes from LGBT Foundation's It's a Question of Sex, which was around women, LGBT women and their attitudes around sex and what kind of sex they're having, and all that fun stuff. And there was over 2,000 responses to this survey, so it was a really fantastic amount of data that we got. So this here, when having sex, do you use barrier methods, and if required, contraception, dental dams, condoms, PrEP, etc. So the breakdown we've got here is 7% saying always, 31% saying sometimes, and 62% saying never. That, I think, for me is really indicative of the, again, myth that women who have sex with women can't get STIs. There's this notion, an entirely false notion, that is the case, that if you don't sleep with men, you won't get STIs, which is just not true. But again, is something that we need better education around, not just amongst LGBT communities, but also at a school level, starting, you know, from the ground up, to be talking about, you know, it doesn't matter who you're having sex with, you need to be thinking about STIs. Another barrier that we have is general anxiety around healthcare settings. I think anyone can relate to having some anxiety around healthcare settings. There is an added layer as an LGBT person about how you are going to be treated in that environment. There are a lot of negative experiences, unfortunately, for people, and so that makes it difficult to reach out and engage with cervical screenings when it's not something that you necessarily want to do, even though you know you should, and so that can be a barrier in itself. I think specifically around cervical screenings, when you are talking through with the practitioner what is going to happen, and you're being asked questions about yourself, there will be the question of, are you sexually active? To which, if you answer yes, the question will be, are you on any contraception? Do you use any contraception? And then you have to choose whether to out yourself or not, because if you answer no, you might get asked, why is that? You might be given a lecture, as is in this quote here. And that is a really difficult position to be in, because if you do choose to come out to a stranger, you don't know what their reception is going to be. You don't know whether you're going to be treated the same if you didn't come out to them. But sometimes it can be the only way to shut down a conversation about contraception that is not necessarily relevant to you. So we've got two quotes here. Came out to my nurse, she kept asking about contraception and sex, so I had no choice but to tell her. When I told her, she was very rude and tried to get me out of the treatment room as soon as she could. That's from Megan. And another, I went for a cervical screen test and I was asked if I was sexually active. When I said yes, I was asked if I was trying for a baby. When I said no, I was asked what contraception I was using. When I said none, I had to endure a 10-minute tirade about how irresponsible I am. And again, this is, I'll talk a bit more about what we can do against that, but just feeds into this notion that it's not something that people want to engage with because they might have to come out, and really that's not something that someone should have to share in order to access healthcare. It's not about who you're having sex with, it's about whether you have a cervix or not. Yeah, so there's another barrier here that's quite tied really to that anxiety, and also being LGBT in healthcare settings. So there is a lot of heteronormative assumptions and language use. By heteronormative, I mean the assumption of heterosexuality, of a man and a woman being a couple, and all of the notions that come with that. So a lot of the language that gets used to soothe people about this might be, when talking about the speculum, oh, well, it's smaller than a penis. That's not necessarily comforting for someone. You don't know what kind of sex someone is having, regardless of their sexual orientation, and you don't need to know in order to provide the healthcare that you are, there to do. But this is something that, from personal experience, it comes from a place of camaraderie. It comes from a place of, you'll be okay, but it really can miss the mark for a lot of people. And personally, I think just saying like, hey, this isn't fun, but you're going to get through this and you'll be fine, is a lot more productive than saying, oh, well, it's smaller than a penis. There's also the language use around speculums. So I have permission to share an anecdote of someone who had difficulty with their own cervical screening twice when accessing it at the GP, was then sent on to a specialist and was told that they would use a virgin speculum. This really makes me very cross, because it completely undermines that person's relationships, the sex that person has had. It devalues it and again makes the notion that real sex is a penis in a vagina, which is incredibly undermining and just very untrue. The phrase virgin speculum makes me really, really cross, and it just say extra small. It's that simple. It would be remiss of me being here as a member of staff at LGBT Foundation not to mention cervical screenings are also accessed by trans and non-binary people with cervixes, as Sarah mentioned there. I would again mention Joe's Cervical Cancer Trust, who we did some work with, and there is a guide specifically for trans and non-binary people accessing those spaces. That is pretty good, if I say so myself. So what can we do about all of this? Well, there's some really big changes that need to happen that boil down to better education for all involved. So we need to challenge these perceptions around STIs. We need better education around the purpose of cervical screenings, what they are for, challenge that belief that LGBT women don't need one, both in LGBT women communities and in healthcare communities. Like I said, that stat is from almost 10 years ago, but again, a lot of those people will still be accessing cervical screenings. There also is need for more inclusivity in primary healthcare, particularly around the language we use and perceptions of sex. So two projects that LGBT Foundation is involved with is Pride in Practice, which recently had its 10-year anniversary, which teaches primary healthcare providers around how they can be more LGBT inclusive in their day-to-day dealings. And we're also involved with NHS Rainbow Badges and their working within the NHS to again be more LGBT inclusive. It's no mean feat, but it is incredibly important because there are just far too many people missing not reaching out for their cervical screenings, and also far too many people who are accessing cervical screenings who are having poor experiences, who are being put off from going back, who are not encouraging their peers to go and get one. And so I think it's really important that we do. So thank you very much.
Thanks, Ellie. That was really, really helpful. And I was laughing, not at it, but I was thinking about all the things that have been said to me over my aged years by health professionals, some of which you've just recounted. So the next stage now, first is I'd like to say thank you to Sarah and to Ellie. I think have really, one, explained what's involved and why cervical screening is important, and two, really also explained why some of us don't really want to go for it. And in a bit, we're going to have a video from Girl Gang Manchester, which I think sets the broader context for women more generally in terms of what they think the barriers are and how they approach that. So the first thing I wanted to do just now is see if there's any questions for either, or comments from either Sarah or Ellie. I'll keep buttoned for a bit and throw it open. So if you can either use your virtual hand or your real hand, if anyone wants to come in with a question or a comment. Martin's going to keep an eye on the chat and we'll come back to there. So Ellie's going first. Go on, Ellie.
Yeah, I do. I have a question for Sarah, actually. Can I ask, do you know why people with HIV are offered screening annually?
Yeah, it's because having a lowered immune system can kind of make the HPV virus develop into cell chasers things much quicker than someone who's not immunocompromised. So that's why they're offered it annually. Previously, again, the kind of computer system couldn't do that automatically, and the person would have to present each year to their GP practice and kind of, or their GP practice would have to do it manually. But that has changed now. And if the lab and kind of the more computer system things are aware that that person needs annual screening, then they will get the invitations.
Thank you. I didn't know that. So thank you very much.
That's right.
I just wanted to say that I think it's really, really important that every single person that's attended this event goes on and talks about it and just has that conversation with somebody that they know. We can start to get the messaging out there, and this is why I think, you know, these sort of events that we're doing are so important. And it's just there is an interview I did that's going to be shown a bit later on, and even that person was quite surprised about the skin contact and the sex toys. So I think, you know, that information really does need to start to trickle through the community, that, you know, we need to be aware that we, you know, even though we don't have sex with men, you know, we are very important. It is important we take up our screenings.
We've got a question from Angela Rayner, actually, and then we'll come back to Anne. So Angela's put in the chat, she's on her phone and she's traveling. So she wants to know, I wonder if you could confirm, Sarah, if a woman has had a hysterectomy, is there no reason for them to continue with a smear test?
It depends on what the person had done. So if they had we call a total hysterectomy, which is where everything's removed, including the cervix, then they don't need cervical screening anymore. However, sometimes some or all of the cervix does get left in place, and in that case, if it's kind of a subtotal hysterectomy or partial hysterectomy, then they might need cervical screening. So normally after the operation, the consultant would recommend whether screening is required or not going forward.
I think that really makes it clear. Thanks, Sarah. Angela, was that okay? You put a thank you in the chat. So if there's any follow-up, put it there. That's great. Thank you. I think, Anne, you're off mute now and coming in with your question.
Right, yeah. I was just wondering who set the age barriers, because as we know, there's a lot of younger people now than when I was younger, but that are having sex. So, and I think there was a bit of a pressure group, wasn't there, when a young woman died at the age of about 18, which really is an adult age now. So who sets these barriers? And also at the other end, nobody ever tells you. I found out about breast cancer, you can carry on having it if you want, but you've got to request it, but nobody tells you that. So I don't know if anybody tells people about that they can have it after the 65 if they wish to. But really it's the young age that I think needs to come down from 25.
Thanks, Anne. Sarah, do you want to take that one?
Yeah, sure. So there's something called the National Screening Committee, which we all know because of COVID of the JCVI, who are the kind of national body who make the recommendations for immunisations. So there's a similar thing for screening. So the National Screening Committee review evidence. They look at kind of incidences of cervical cancer. They look at the new technologies and how the tests can be done, and they make the recommendations to who can be screened. So in some countries they do screen younger, and you can be screened from the age of 20, but the evidence has shown that those screening programs don't pick up a significant more number of women than we do in England. And also, as I mentioned in my presentation, there are risks to cervical screening and that treatment that can be carried out. So for a lot of women, the virus and the cell changes will resolve themselves, and screening people younger would mean that more people got treatment that they didn't need, which then can potentially cause future complications like premature births and things like that. So it's always a very kind of finely weighed up decision of, do we screen younger and maybe there's a high risk, or do we wait till it's older, and currently the age is 25 because that's kind of where the risks, they've decided to kind of make that cut off, if that makes sense. So with all our screening and immunisation programs, people are there's a cut off, or there's an age group, or and it's about the evidence really, and what's most effective and least harmful.
Okay, thank you.
Thanks, Sarah. Thanks, Anne. So I obviously you've got to start somewhere, but I thought Anne made a good point really. But for the life of me, couldn't understand the 25 and a half. It sounded like something from Harry Potter.
So it's supposed to be 25, but they send the invitation a bit earlier. So they send the invitation when you're 24 and a half, so that you can be screened by the time you're 25.
Good. There's logic to everything, isn't there? I'd really like to know if anyone else has got any questions or comments before we move on. Last chance. I don't think there's anything in the chat, is there, Martin? No. So, I mean, I'd just like to ask you, Ellie, when you say what can be done, I think it's a really good question, because whilst some, in my lifetime, some people are more enlightened than others, I still think that there are massive issues in terms of attitudes and the kind of questions you get when you engage, particularly with primary care. So I think Pride in Practice is great. And obviously going from a pilot to being commissioned across Greater Manchester, and I think also the rainbow badges, but in terms of education, and it's educating our communities and our families and friends, isn't it, as well as educating in practice. But I just wondered, and I'll ask you, Ellie, and then in terms of, if there's anything else that you want to recommend that we pick up as Answer Cancer in terms of what can be done, and then I'll ask you the same question, Sarah. That'll be the end of the question part.
I think broadly, like, educating people to actually understand, to understand these barriers, to understand what LGBT women are coming with when they come to a screening, and that is incredibly important on the side of healthcare providers. I think it's also incredibly important on the part of those accessing the screenings, because I think it's really difficult to self-advocate in healthcare situations, like, regardless of who you are. I think with all these additional layers, it becomes more and more difficult with a procedure that for some is intrusive, invasive. It's a difficult position to be in. It's very, very hard to self-advocate, and so to have all of the information on hand of, this is why I'm doing this, this is what I can ask for, this is how it will happen, is the most empowering thing we can do for individuals accessing screening, until we can more broadly educate everyone and how not to be LGBT phobic in the workplace and beyond. So yeah, I think education is the key really for everyone involved.
Thanks, Ellie. And Sarah, anything you want to add?
Yeah, I think one of the things that we really advocate for in our team is for practices where possible to have pre-screening appointments, which are particularly for people who are just reaching the age of screening and never been screened before, and offering that opportunity to just kind of come without any pressure that you're going to be asked to take your trousers off and just ask questions, learn what's going to happen, talk through what's happening, and then come back at another time if you don't want to have it straight away for the actual appointment, just to kind of remove some of those fears and things like that. And that's something we really encourage GP practices to offer, to kind of make it a bit less scary for people, I think, and give them that opportunity where they don't feel rushed to ask questions.
That's helpful, thank you. And there'll be in the next segment of this exciting evening, we'll be talking potentially about whether trousers are a good idea. So we're going to move on now to, we're going to share now a video, and it's called Smear Fear. It's from Girl Gang Manchester. I don't think any of the Girl Gang Manchester women are here tonight, so I'm going to introduce it. So Girl Gang Manchester it's a collective of female artists, activists, academics and party instigators who produce accessible, fun and meaningful events with masses of passion. This is their self-description and creative flair. What I would say is we worked with them at Answer Cancer recently, last year, and we commissioned them to help us produce a video to encourage young women to attend cervical screening appointments. It's fun, it's a bit of lightheartedness, but it's got a serious message behind it. And although it's not aimed exclusively at lesbian and bi women, it's intended to be fully inclusive. And I think the really important message is that here, if we think about the barriers to any woman going for cervical screening, and then we add on some of the things we've just discussed, as Ellie's pointed out, in terms of lesbians, bi, trans and non-binary people with a cervix, then I think it just makes us really, really think about what kind of messaging we all want to participate in to persuade our friends and family, and also influence health practitioners. So Martin, I think if you could share the video, that'd be fantastic. And just a reminder to put, sorry, I look to the side then, Fatal, there's some interesting stuff going on in the chat, and Angela's put a really interesting appointment in around the pre-smear appointment idea. So I'll refer you to that while Martin shares the screen, and then sit back, get your popcorn out and enjoy Smear Fear from Girl Gang Manchester.
Smear Fear? Here are some handy tips and info to help.
What do I need to prepare?
Absolutely nothing. Girl, you don't need to make any effort whatsoever.
I don't need to shave?
Nope.
How about a wax?
No, babe, you're good.
Surely some nice knickers, at least.
Nuh-uh.
So you're telling me I don't need to do anything at all?
Yes. Do you know how many vaginas a nurse sees a week? Girl, you ain't special. There's nothing these nurses haven't seen before. And the last thing they're doing is passing any kind of judgment. However, if nerves get in the way, do whatever makes you feel confident.
What else can I do to feel better about my appointment?
You may want to wear a skirt for easy access. You can bring someone you trust along with you, but make sure to agree this in advance with your healthcare professional due to COVID-19 guidelines. You can book a double appointment so you don't feel rushed. We're a big fan of motivational playlists. You can even create a character if it helps you get the job done. Get yourself inside, love.
But what actually happens during a cervical smear?
You'll be greeted by the nurse, who will ask you a few questions. Time to whip off your knickers and lay down. Spread 'em. Well, not exactly. You may be asked to raise your knees like this, or there may be stirrups, an unnecessarily scary word for something you just put your feet in. It's almost time for the screening to begin. Lube should be part of the process. If you don't hear that trusty sound, just ask. Speculums look like this, and you can ask for a smaller one if you need. Once the speculum is inside you, it's open to give the nurse a better look at your cervix. This is the swab they use to take the cell sample. Okay, we're going in.
Well, we've got a minute. It's worth saying that a lot of people think cervical smears are there to detect cancer, but they're not. They're actually there to detect precancerous cell abnormalities, like HPV. The human papillomavirus is transmitted through the skin, most of the time through sexual activity. Some people think you can only get it through having sex with cisgendered heterosexual men, but that's not the case. People with wombs can transmit the virus too, either through physical contact or via sex toys. But the most important thing is that the early detection of these cells means a high cure rate. In fact, 9 out of 10 people who are treated will never have cell abnormalities again, and 95% of smear tests are clear. Oh, I think you're almost done.
Wow, that was fast.
Whilst the length of your test depends on a few things, most are about 20 seconds to 2 minutes. And now you're free to go and smash the rest of your day. So, now you've dealt with your smear fear, spread 'em. Spread 'em. Spread 'em.
Hashtag spread to pledge. Have you been putting off your smear test?
Get it booked now. The most at risk group are women 25 to 35.
Join us by spreading to pledge. At Girl Gang MCR. At Answer Cancer GM.
Hashtag spread to pledge.
Thanks, Martin. So, yeah, some good messages in there, and I think clearly in line with what Sarah was talking about earlier. I think that's available on YouTube. So Girl Gang MCR. It's also on our YouTube channel, Answer Cancer GM. So if you want the links, I'm sure we can put them in the chat, but please do share it. Share information from Joe's Trust, share information on our website. I think that share information from the LGBT Foundation, the Health and Social Care Partnership. I think what's really important is we have conversations with each other and the people that we know. And there's a wide range of material available to get the message out there, whether traditional or a bit more irreverent. I think I nearly said irrelevant then. So thank you very much indeed. Sarah's not run off screaming, so it obviously wasn't that far from the mark. And if you don't know about Girl Gang Manchester, it's girlgangmcr.com, the website. Really interested, and they're on Twitter. So I'm now going to pass to Vanessa to introduce the next segment, which is an interview that Vanessa did with Horst McDonald, who's a Scottish singer-songwriter. But I'm going to let you introduce it, Vanessa.
Thank you, Alison. So I did, yeah, I had the amazing opportunity to sit down with Horst McDonald, who is a singer-songwriter from the community, who's quite veteran, I think, and well known amongst the community. And she was just really passionate about supporting the cause and being somebody that came out quite a while ago. And I'm trying to be respectful, so not be ageist, but also very much was aware of the conversation about how, you know, women didn't need to have cervical screening if they were not having sex with men. So yeah, I hope you enjoy it. I had a brilliant time chatting to Horst, and I know she'll be interested in she would have actually come, but she's in Berlin at the moment. So but yeah, so enjoy. So thank you very much for taking the time to speak to me today. As you know, we're running this campaign, this event around specifically for lesbian and bisexual women, to change the narrative of the conversation that was very, very sort of prominently embedded in the community was, unless you had sex with a cis heterosexual man, you didn't have to have cervical screening. And we now know that that isn't the case. You know, the virus that causes cervical cancer can actually be transmitted by skin. And it can also be transmitted via sex toys. So, you know, it's been a challenge to now go back and have that conversation, and because it has been embedded for so long. I mean, what has your experience been going back from sort of past to now? Have you had the conversation with people?
I have in my own head, I think, and I think the first thing to say is whether someone, no matter what someone's sexuality, I think most women do not like to have a smear test, regardless of their sexuality. And for me, being a woman at all was a difficult thing to deal with, never mind going for a smear test. And it took me a long time to actually go. But I think we're all human beings. And I think that's the first thing to get over, actually physically having someone, you know, do a smear test on you. And it's, everyone has the same issue with it. So compounding all of the problems with sexuality, or worrying about that. Yeah, and also just cancer. It's just this thing, ostrich will just not bother with that one. It's not going to affect me, so I'm okay. So I think all of the above is possibly a lot of my thinking from teenage years on. But even people, my own peers, they're like, oh God, oh no, I've got to go for a smear. It's not something I think that's going to go away anytime soon. I think what we have to get over is that with technology, etc., that if you go more quickly and do these things, then the benefits far outweigh that 5 minutes on a couch. Embarrassing as it is, and uncomfortable as it often is, and painful sometimes. So I would say that's my main sort of take on it.
Yeah, absolutely. And I think you know, sort of what we're trying to achieve in this program is to sort of make people aware of the things that they can ask for to make it a more comfortable experience. So you can actually ask them to make sure that they have more than one size speculum. It's not one size fits all. And actually,
see, I hadn't known that until recently.
So this is I don't think enough people are having this conversation and actually going, well, no, they don't have to use, because you do.
Maybe they're not given the choice as well, potentially, you know.
Yeah, no, well, this is it. And I didn't know that until I started this program, and I was like, oh, no way. Like, because it is a prominent thing that's used in the community, and also skin. So even hand to skin can transmit the HPV virus. So, you know, it's quite, when I thought about it, I thought, gosh, you know, there is actually a lot that people don't realize. And I've gone with a few of my friends and had their first smear test and held their hand, and, you know, and sort of made sure that they were had various size speculums, that they weren't having to, you know, one size fit all, because, you know, there are a lot of differences. We're not all one size fits all, just like men are not all one size fits all. But, you know, women are somehow expected. But, you know, there are things that people can ask for. You can actually ask for somebody to go in with you. You know, the things that you can do to make it a more comfortable experience. And, you know, sort of taking the sexuality element out of it, you know, the other thing that we're all looking at is also how to make it a more inclusive screening process for gender. Because, you know, that we wanted to do it separately, because, you know, sexuality and gender is a very separate conversation.
Yeah.
But there is that sort of, even within just the LGBTQ community, there's a lot of queer, non-binary and transgender people that won't go for cervical screening because of the dysmorphia that comes with having these
well,
body parts.
growing up as I did, thinking that I was possibly transgender. In those days, there wasn't that language, and I was, as far as I was concerned, I wasn't a woman, and I wasn't a man either, and I had years of not being sure what I actually was. But if that's how I felt, I can imagine how it would feel to not want to present yourself there and put yourself in that position because you're mocked. I mean, there were times, I've been several times for different things in hospital, and I've heard them whispering behind the curtain, so you can imagine how someone would feel. It's not allowed anymore, thank God, for that kind of behaviour, but I'm sure it still goes on.
Absolutely.
Fear of it would probably outweigh your necessity to go and be tested.
Well, this is the thing. I think that's then now stopping people. They would rather just wait and see. Mm-hmm. And it's like what you've said, working on this program and around the screening programs that are out there, the earlier that anything is found, the better outcome. And especially with cervical cancer, because it is non-symptomatic. And by
something else that's come out of what you're saying just now, and I was struck by, is the skin contact causing this. I think in the last 2 years since the COVID explosion, our awareness of how quickly and easily we can spread stuff. I'm only too aware when I tour, I meet people, and every year, every time I've toured, I've got a bad cold. And we laughed at people from Asian countries wearing masks, but we're not laughing now. And I actually think that's one of the big surprises. I think our cleanliness, excuse the phrase, stinks. And I think, we have to be a bit more fastidious in our cleanliness when we're having contact with someone else.
So, I think the more that we can have it, and the other thing is as well, is that I think also sex has always been taboo. And I think that for me, we have to take the stigma out of talking about sex and making sure that, it's not even just about changing the conversation in sort of the more sort of older LGBTQ community, but it's also about having those conversations with the younger girls that are coming up, and educating them about cleanliness, about using protection, and making sure that if they don't sort of have those protective barriers, that they need to then make sure that they're going for their screening.
But I think there's certainly we used to talk about permissive society, because I'm 63 now, and so we're going back 40 years, and they were talking about permissive society and who are misses and all of this. But I do think through social media, people's learning experiences are through social media, as opposed to proper places with proper information, and people are learning about sex but it's not about love, it's all about sex. And I guess when you're growing up, there's that kind of initial excitement, etc., and it's not going to happen to me. Men in particular, young men in particular, not wearing condoms, it's like the women's responsibility, that stupid thing. I think, young women growing up will be absolutely thinking this is not going to happen to me. Because for women who are not going out with men, they will think, or cis heterosexual, they will not, be thinking this is going to happen to me until it does.
Absolutely. And, and as I was saying, the thing with cervical cancer is it takes 10 years between your stages. That's how much of a slow cancer this is. And that if it gets found, it's generally in stage 4.
It's well established.
Which then it's well established. And we're so lucky as part of the program we have Dr. Immunisation, who has dedicated her life to cervical cancer prevention. And she's educated me so much. And she was like, there's 10 years between these stages, you know, and if we can get girls to go and have their smears as part of a health check, rather than it being you know, almost like it's a cancer screening. We're not screening for cancer. We're checking, and now they don't even check for cells; they check for the virus. So they've even changed the way they do the testing. You know, you could literally eradicate cervical cancer.
Well, my mum had ovarian cancer and died of ovarian cancer, so I'm pretty aware, and you know, I've had tests and things. So I'm sort of aware of it now more than I would have done when I was younger too. But it's easy to shout backwards and go, no, you need to, you know, I know I didn't, but you need to. I think spreading that knowledge is really, really important.
And I think, you know, you're right in that you've brought it up, you know, everybody in every community, regardless of your orientation, we all have a period in our lives where we are a little bit more excitable and promiscuous. And, you know, and I think if we can educate people now, so that they are having these sort of encounters, that they know to use a condom on their sex toy. Like women who sleep with women don't think that condoms are a necessity, because they think that it's generally either a gay sex or a cishet sex that would use a condom for protection. But if you're sharing sex toys, use a condom.
It's interesting, isn't it? I don't know if you know any facts, but it's interesting, you know, the women who've had cervical cancer, I mean, who are lesbian or, well, specifically lesbian, say, is there any way of, is it a big surprise when they have the cancer if they've not been aware of it? I mean, there's no way of sort of going through everyone who's had it and going, well, these people are straight, these are not, you know, or these are lesbians, etc. So I just kind of wondered if it's one of those things that it's a growing awareness, or.
So recently, obviously, the medical statistics behind our community, the LGBTQ community, has actually been very, very minimal, because as a community, we've just not wanted to tell people. You know, and there's a lot of, I don't know if you've heard the conversations about even just telling your GP your sexual orientation. Well, why should I have to tell them my orientation? But the thing is that it's so that we can start to collect this medical data. So at this point in time, there's not really much telling us how many women who have had cervical cancer actually are lesbian. And I think, you know, this is what we're trying to do as a program, is to try and get that information. So let's get this information. Let's see what we could have done. And also, would they be willing to share their story, you know, to start educating people on how important this is.
I think talking it's one of my favorite things, but talking is a powerful tool. It's like almost like testifying your own experiences. I don't know if anyone who's had cervical cancer is going to be involved in talking about anything, but I think that would be quite useful as well. So I don't know.
Yes. So there you go, Horst McDonald doing a call out to other lesbian and bisexual women to get involved.
Well, I'm obviously happy to share this, because I think, like you say, the people who are anonymous here, and I think that's very powerful and very important. And I think every single woman I know does not like having a smear. I think a lot of lesbians do feel like they get missed out of things, or they're being sidelined, etc. So I think it's really important what you're doing. So I mean, obviously, I for one will be. I can share anything you want me to share, you know, about it. I'm more than happy to do that. Well, at the end of the day, it's a no-brainer, is it? It's like you just have to do anything you can. And if I reach, I don't know, 1,000 people, those 1,000 people will reach another 10,000 people, etc. That's just the way it works. And I think the other thing that has come into my head as you're talking, you're saying 25 to 30-year-olds, I think the awareness of having to have a smear has taken years for my generation to realise. But it starts to fade. People need a constant reminder about it. It's the same with, I suppose, all cancers. You have to check, you have to investigate, you have to go soon, sooner rather than later. So I think on a regular basis, information like this has to go out.
Absolutely. No, I agree. So
let's do it.
Yes.
And thanks to Vanessa for sorting and sourcing and interviewing course. It's an interesting video, so please do. So what we're going to do now, we're running slightly over anyway, because I'm a hopeless chair because I asked too many questions. So we're going to move on now, but back to Vanessa to do a little quiz, and then we'll have a sum up. You can all go and get a cuppa.
I've got to feed the children. They're like the door like this, looking through, going, "Have you finished yet?" Just I know I'm dreadful, and I'm going to have social knocking on the door. But I will say, Stuart, I'd like to reach out and have a chat with you outside of this, just because of the event that's coming up, which I'm sure Alison will chat to you about. We're doing specifically around transgender and non-binary community members, and we've got some really exciting opportunities to actually hopefully make some changes. So within what we're looking to do, and the gender clinics and the care packages and things like that. So right, I'm going to see if I can do this. So I'm going to play 5 seconds of each song, and you get a point. So just write down on a piece of paper the title and the artist, if you can. Right, you ready?
Is it a point for each or 2 points?
Yeah, I'll make it 10 seconds because some of them are a bit tricky.
Is there a theme, Vanessa, we should be looking out for?
So all of these songs are known to the lesbian and women who identify as bi community. You should know them. They are well known anyway to the community across all LGBT. And there is 1 or 2 songs with some naughty words. So if you're under the age of 18, please don't listen. But I don't think we've got that issue. Right, so here we go.
This was never the way I planned, not my intention.
Okay, that's number 1. Okay, number 2. Okay. Number 3.
All of the lies I believed got the best.
Okay, number 4.
It doesn't matter if you love him or capital H-I-M. Just put.
Okay, number 5.
All I wanna get is a little bit closer. All I wanna know is.
So that one was actually quite easy if you knew the song. Okay, this is that. I didn't know this one, but I think this might be a tricky one. Ready?
Your pussy is God and I love it. Gonna kiss me real hard.
Okay. Number 7.
You got that thing that
Number 8.
I want
Number 9. And the last one, number 10. Okay, does anybody want to hear any of those again? Do you want to drop them in the chat?
I don't think it'll help, to be honest.
To be honest, Vanessa, it just shows the age gap. Can I just say that? Because there was, when I was young, it was Alex Dobkin. Any woman can be a lesbian. And if you don't know that, look it up. It's on YouTube. So, I'll probably get about half out of 10. But if anyone is happy, should we get the answers? And then we can recognise our lack of knowledge or otherwise.
So the first one, it was Katy Perry, I Kissed a Girl. And the second one was Mary Lambert, She Keeps Me Warm. One of my favourite songs. The third one was Daphne Willis, and I Am Enough. And she is a lesbian artist. The fourth one was Lady Gaga, Born This Way. Number 5, does anybody get number 5? Tegan and Sarah, Closer. Number 6 was King Princess. The P word is God. I can't say it. It's just a word I can't say. I find it really hard. That and the C word, just it doesn't come out my tongue. Number 7 is Sexual by Naked and Dio. Number 8 is I Want to Be Your Girlfriend, Girl in Red. Number 9, She Likes Girls, Metro Station. And number 10 was I Don't Do Boys, Electra. Do you see the theme?
Yeah, we see the theme, yeah, even though you can't say some of the words. Can I just say, did anyone get 10 out of 10? Get them all right. 9. 8. I've got a 7 out of 10. 7 out of 10. Who got 7?
Oh, well done. 7, 1, 5, 2.
Any advance on 7? Who got 9?
Yeah, did you say somebody got 9?
No, I said 7 out of 10 from Elle.
7.
Stuart got 5. 50% ain't bad. Any advance on 7?
Rachel got 6.
Rachel got 6. 6 is good. Have you got a prize for us, Vanessa?
Should we give away? Should we do a voucher? I think we should do a voucher.
Do a voucher and an Answer Cancer T-shirt. How about that?
Yeah. Okay.
Yeah.
So what we're doing, top 3.
Yeah. Go on. Yeah. So top 3. So if you want to be in for an Answer Cancer T-shirt, you make sure you put your score in the chat. How do you know Rachel got 6?
She messaged just me, I think.
Yeah, I was going to say, right. Okay.
Okay. So far, first place we've got Elle. So I'll drop me your email, please. And we have actually got I don't know if that's, sorry.
So we've got Elle, we've got Rachel, and we've got Stuart, who are getting the blankety blank checkbook and pen, and nobody will know that reference.
I do have Pride T-shirts now as well, so we can do it in Pride colours if you would like.
Excellent. That is fantastic. So thank you, everyone. We'll make sure that we have a range of music questions next time for all ages and abilities. But in the meantime, can I just say thanks ever so much to everyone who's come along tonight. In between a bit of fun, yeah, please do watch out. We've got a website, Anti-Cancer GM, and what's the other one, Martin? Anti-Cancer Champions, is it GM at the beginning?
Cancer Champions GM.
Cancer Champions GM or
And
Anti-Cancer
Anti-Cancer
GM, but both are front doors into a two-facing website. We are on Twitter and other social media platforms. We have got a YouTube channel and the video with Horse, but also lots of other videos, some really interesting conversations with our partners, conversations with our cancer champions. Martin's put the website in the chat, www.anticancergm.org.uk. Please keep an eye out. As Vanessa has said, we are doing a range of events, which we do anyway, particularly in terms of LGBT communities, LGBTQ plus communities. We are having an event on trans and non-binary people, and I think we'll take that opportunity to catch up with you, Stuart, to inform that. We do events around the 3 screening programs, and obviously also the national weeks and months like Bowel Cancer Awareness Month, etc. We're a Greater Manchester initiative. We always welcome people joining us, coming to our events, signing up as an individual champion. It's not onerous, and it's really important that we all have those conversations with our friends and family and work colleagues. And also you can sign up as an organisational anti-cancer champion. So if your organisation isn't signed up, can I encourage you? We do have training sessions which you can book onto, and we're a friendly bunch, so you can contact any of our colleagues. So if you're not signed up to our information, you can contact us directly, or you can put your contact details in the chat, and you can do a private message to Martin, who will then pick those up. So thank you very much indeed. Any final points from anyone? Any colleagues? Thank you ever so much. We have recorded this. Nobody's said the P or the C word. Well, we have said cervix actually, and cervical. And we will be sharing this. So it's good to see you all. Thanks ever so much. Spread the word. Yeah, spread to pledge, and see you next time. Thanks ever so much.
Thank you.
Thank you.